Hi everyone, welcome back to my channel. Here on Emergency Medicine on Demand, I go through various patient cases in a very simplified manner. I do one case per episode where I discuss the patient's condition, signs and symptoms, and course of treatment in layman's terms. Yes, you heard that right. This is not the type of channel where you have to pause the video to look up a word. I am not trying to look smart here. I am teaching you in the manner that I wish I was taught in. So, if you hear a big word, you can be confident I will be going over what it means. One last thing before we get started on today's case. I always share a motivational quote at the end of each video. Life can be tough, so I hope this simple gesture can change your outlook. And now, without further ado, pay attention. Today's case is on seizures, specifically the tonic-clonic kind. Tonic-clonic seizures used to be referred to as grand mal seizures. Both of these names are referring to the sudden convulsion type of seizure type that most people think of when we hear the word seizure. Now that we understand the patient's condition, let's go over the patient's symptoms. Some of the signs you would see in a patient with this type of seizure include sudden jerking of the arms or legs, arched back, muscle stiffness, loud groaning, and loss of bowel control. Now, how is this treated? Well, there are two instances we will discuss. If you were a bystander and you watched this happening, we will go over what you need to do at the scene. Then, we will also cover how this is treated at a hospital. For the bystander scenario, you would do the following. Call 911, place something soft under the person's head. Sit next to them and time their seizure. Only turn them on their side if it is safe to do so. Do not under any circumstances place any objects in their mouth or try to hold them down. For the hospital scenario, you would do the following. You would administer a benzodiazepine, which is a class of medications that are depressants. You can think of them as drugs that will sedate and relax you, which is why they are used to treat seizures and anxiety, two activities that are activating and arousing to the body. The benzodiazepine drug you would give can be one of the following: intramuscular or intranasal midazolam, intravenous lorazepam, intravenous diazepam, or rectal diazepam. Intramuscular means the drug is injected into the muscle, such as the arm, so think of where you get injected when you go for a vaccine. Intravenous means in the vein. Intranasal means in the nose, so think of a nasal decongestant that you use when you have allergies. Rectal means in the butt using a syringe tip. Reminder that only one of these options is given to the patient. Also, keep in mind that if the seizure continues for more than 20 minutes after any of these medications were given, a second-line treatment option would be needed, but we will not be covering that here. As promised, here is today's quote. "The body achieves what the mind believes" by Napoleon Hill.